to continuation from the last class, from the last theory class, what I have said that to make a stable population in a country, we cannot increase the death rate. What we can control? The high birth rate. And the only way is family planning. Okay, then what is family planning? Plan for a family. So, who will be the doctor, who will be the army? It's not like that. WHO gave a suitable definition that a way of thinking and living adopted voluntarily upon the basis of knowledge, attitude and responsible decision by individuals and couples in order to promote the health and welfare of the family group. The main point is it should be voluntary, it should be taken by the individuals or the couples, okay. It will not be planted in their mind. We will give them all the available options, they will choose on their own and they will practice and they will know what are the benefits of using this method, what are the disadvantages of using this method, how much effective this method it is. These are the main points in the definition. Sometimes these alone words might ask in your coming exams. When the definition will be in Viva, in your Viva probably examiner will ask you that what is family planning. This what the examiner want to hear from you, that it is voluntary, based on their own knowledge, chosen by the couples or individuals themselves. These points you should mention, otherwise it is of no use. What are the benefits of family planning? It might ask, it might come as a short note or 3-number question. That is the way you should write the benefits on the perspective of 3 levels. First is mother, second is fetal and third is the children, okay. Where it is the family planning, if you adopt family planning, it reduces the maternal mortality, morbidity, prevents unwanted pregnancies, ensure optimal birth spacing, reduce risk for fetal, also again decrease the mortality and morbidity. For child, again the same, reduces neonatal, infant and perinatal mortality rate, under 5 mortality rate, promotes growth, nutrition and also prevents the prevalence of malnutrition, okay. That is how you should write it in your copy. Mission Pariwar Vikas, in 2016, Government of India launched this Mission Pariwar Vikas in 146 high fertility districts, okay, where TFR was very more than 2.1, which is desired. The total fertility rate is desired is always 2.1, but these 146 districts, districts from Bihar, UP, Rajasthan, MP, Chhattisgarh, Assam, here TFR was very much more than 2.1. So what was the goal? It was the increased access to contraceptive and family planning services. Okay. Here also we will know that if one ASHA worker, when introduce you to the family planning method, she got some incentives, that is rupees 500. Again, if the couple after getting into the eligible couple register or after the marriage remain childless for the first 2 years of marriage, again that ASHA will get 500 incentives, okay. Then if there is proper spacing of between children, that is 3 years, again the ASHA servicing in that area, the couple residing will get 500 rupees incentives. So the ASHA will usually counsel every eligible couple in rural area mainly. And here the incentives in Mission under those districts where Mission Pariwar Vikas was happening, the incentives are much more, because these areas are resistant. They usually resist to using any couple, any contraception method or any family planning methods. And the mission, and just see, in 146 high fertility districts, it is catering 40% of India's population. 40% of the India's population is living in only this 146 high fertility areas. Just imagine how much fertility rate will be in that area. Okay, these 5 points are under the Mission Pariwar Vikas, thus delivering assured services, promotional schemes, ensuring commodity security, capacity building and enabling environment. If you visit any government hospital, that is PHC or any sub-center or even sub-divisional hospital, in front of the pediatric ward and in front of the gynae obs ward or the OPD, there are these pictures, okay. This picture that showcasing all the available contraceptive methods provided by Government of India are showcased, okay. What are the advantage, what are the effectiveness, what are the disadvantage, somewhat all the disadvantages are not written because it will dissuade the couples, but all the advantages is being written there, and what is the effectiveness, okay. Now what are the contraceptives? They include both temporary and permanent. What are the temporary? They are called spacing method. And what is permanent? We all know, that is vasectomy and tubectomy. Those are terminal. If you perform these procedures, usually these are irreversible and you cannot bear child in future. But the spacing and temporary, because it creates a space between consequent childbirth. That's why it is called spacing. And these are the classification. Terminal is always male sterilization and female sterilization, that is vasectomy and tubectomy. And for the spacing method, we have 5 types of methods. That is, first is barrier, that is today's topic, physical, chemical and both combined. And there are intrauterine devices, hormonal methods, non-hormonal methods, which is recently launched. That is also launched in those by Mission Pariwar Vikas, that is Centroman, okay, Chaya. And also there are some miscellaneous methods, it will be discussed later, okay. Today we will focus on only in the barrier method. But coming to barrier method first, coming to the effectiveness. In last class probably it has been discussed how to assess the effectiveness of any contraceptive method. Okay. To measure the effectiveness of any contraceptive methods, okay, there are only 2 types of procedures, okay. You all have read about any clinical trials. How many phases in any clinical trial? Pharmacology it was written. How many phases? Yes? 4 phases. 0, 1, 2, 3, 4. So, where the first living participants are introduced? Human participants are introduced in which phase? Human, sorry, not living, human participant. Phase 1 and phase 0? Animal. And what is the name of the phase 4? Post-marketing surveillance. Just now here we are introducing the contraceptives now. This is what I am talking about, this is the phase 4, okay. Because now we are distributing one contraceptive all over the country. And those who are using, one who will get pregnant despite of using those contraceptive method will report, मैंने ये use किया था लेकिन मैं फिर pregnant हो गया. So that is called accidental pregnancy, okay. So the number of accidental pregnancies will be calculated. So we have 2 types of calculation. One is life table analysis, okay. This life table analysis is actually mainly done in the field of life insurance and any other insurance, okay. Those who done it, it's a very complex method. They are called actuarians, okay. I don't know what, it came from a Latin word, I don't know the Latin word. What they do, suppose any one of you went to any insurance company, suppose LIC, that I want to do by life insurance. So they will first get you a medical checkup, they will inquire about your history. If you have habit of smoking, then you have some less life expectancy. Alcohol, some more. Okay, he exercises twice in a week. Okay, someone up. It's a very complex calculation, it's a very complex formula is also used there. That is called life table analysis. Okay, and the second one is Pearl index. The Pearl index, it is easier, and how it is calculated? The Pearl index of any contraceptive method is calculated by number of total accidental pregnancies in a year divided by total months of exposure into 100. Okay. So, the mathematical expression is very important. Duster নেই? Now, what is total months of exposure? For how many months the couple have used that exact contraceptive method? Okay. Usually the unit of this Pearl index is expressed in 100 women years. Okay. That means if 100 women for 1 year used these contraceptive methods, X amount of total female or X number of female or X amount of couples got pregnant accidentally. Okay, and we are using the unit as 100 women years, but we are getting the total months of exposure. So, to balance this, we multiply it with again 12. Okay. So, here we usually write it 1200. Remember this. This is a problem card question also, to calculate the Pearl index of that area or to calculate the Pearl index of that contraceptives, and this confusing part that it should be multiplied by 1200 if you taking total months of exposure. But in some question, in some MCQ, sometimes it is written as directly year. There you do not take 1200, there you should take 100. Okay. If you take there 12, then you should convert those years of exposure to total month into months. Okay. Otherwise, you will get a wrong answer, and this is actually very easy question. You answer it wrong, rank is 10,000 behind directly. So, again the approach I previously said that when you enter any pediatric department or any gynecological department, the all the available contraceptive methods have been showcased. This term is called the cafeteria approach. If you go to any cafe like that, what, KFC, if you go to any KFC or any pizza joint, all the available pizza and their rates, everything has been written all over the cafeteria, all the four walls. If possible, they will also stick it a sticker in the ceiling or even the floor, but everywhere all the available menu and their price tag has been shown. Same the way, that's why it is called the cafeteria approach. But the cafeteria approach has been now not used because even after showcasing all over the hospital, people are avoiding hospital. Oh, usually the pictures in all the packets are there are some, they have thought this is vulgar picture, so they are avoiding those pictures. They are entering with eyes shut. Actually, I seen that. Usually, when I was doing some district resident duty, there was one box where condoms packet has been distributed freely. Those who can, they can take from that box easily. I saw two people are coming to the OPD. They are avoiding that box from at least 10 meters. That it's a plague. Also, they are not looking at that. One is looking that way because he got interested, probably. But that's how people react to these contraceptive methods. Okay. So what government has been doing? The government is promoting to the eligible couples or newly married couples by going to their doorstep. There, after you go, any newly married couple, usually they are approached by ASHA worker, and ASHA worker is carrying a basket showing all the available contraceptives. Everything is there, OCP, emergency contraceptives, copper T, condoms, everything is there. This approach is called now the basket of choice. Okay. Remember these two terms, cafeteria approach and basket of choice. Cafeteria approach for hospitals, basket of choice when they are coming to your doorstep. Now coming to this barrier methods. First, the male condom. Okay. What are the mechanism or acts of any barrier method? In general, to make a barrier between sperm and ova. Okay. Nothing else. How the barrier, what is the type of this barrier? It might be physical, it might be chemical, it might be both. Okay. Simple funda. Now, what are the non-contraceptive benefits? Protects against STDs and HIV, reduces pelvic inflammatory disease, and may lower the cancer cervix, prevalence of cancer cervix. First, coming to physical methods, male condom. What is the name given by government? Nirod. Remember, first condom is promoted by NACO. Okay. In YouTube, there are many old ads. I think you were very small, you are not born. That Popat Lal, you can still, if you search in the YouTube, get some government actually made those videos and promoted through television. That male condom, how to use, not to be discussed. Advantage and disadvantages. What are the advantages? Easily available, very less expensive. It can be used for any other purposes. Protects against no systematic side effects. What are the disadvantages? Less sexual pleasure. Some might have latex. Some might have latex allergy. Okay, that is a very rare thing, but it might still happen. And also the inconsistent use by men. Men usually do not want to use any contraceptive methods because they do not have to carry the child. So what are the problem? So first coming to this male condom, then coming to the less used female condom. Okay, the brand name is Femidom. This is a remember the bold line, bold words. Okay, what it is made of? That is made of polyurethane. What condom is made of? Latex. Okay. It usually has two rings, inner rings which cover the cervix and the outer rings. It remains the outside. It is also pre-lubricated with silicone, and remember, female condom does not contain spermicide. So nowadays some private companies are promoting condom which also contains some spermicide in the inside the condom. And what are the disadvantages of female condom? It is very difficult to use and also very rarely available, and cost is very high. And the effectiveness, 5 to 21 pregnancies per 100 women years. For male condom, it is 2 to 14. Usually the mean is here 13. Okay. If asked in the exam, multiple options are there in the same range, always mark 13. Okay. What are the other uses of any male condom? It's a very good, what to say, what is the sample? You can take urine sample in that. Okay. And how to discard? It is not to be flushed. You have to tie the end and discard it in non-biodegradable waste section. Okay, it should not to be flushed because it will block your Now coming to the third thing, that is physical method, that is diaphragm or Dutch cap. It is not much available, but remember the picture, it is usually not available under government supply because it is very costly, but it is available in private sectors. So the question or the picture might come in your exam. This is a rubber or plastic cup shaped barrier. It is inserted into vagina to cover cervix. This is used with spermicide. And when to use and when to discard? 4 hours before insert before intercourse, 4 hours before intercourse, and keep 6 hours after. What are the advantage? It has minimal side effect. Okay, and also this is act as physical barrier, and also it contains spermicide, so it is also chemical. So dual action is observed there. What are the disadvantage? Needs to be proper fitting and not practical for rural or low resource setting. Okay, that's why it has been discarded, because the aim of the government is rural or low resource setting women who cannot empower, who cannot buy their own contraceptive products. That's why to provide them at free of cost. This picture has been come to the NEET PG, I think 2017. This is vaginal sponge. It is again polyurethane foam with nonoxynol 9 spermicide. Again, like Dutch cap or diaphragm, it has been inserted before coitus. No STD protection, and the effectiveness is very much high, 9 to 20 pregnancies. Okay. So, and also the cost is very much high. That's why it has been not introduced in the family services given by government. Now coming to the chemical methods, that is spermicides. What are the spermicides? What are the classification? It might be foams, creams, jellies, suppositories, and soluble pills. These things, these spermicides or chemical methods are not provided by the government of India, but these all are available in private. Okay, and the question has been asked from this earlier MCQ exams. What is the mechanism of action? It contains the surface active agents which inhibits the permeation of sperm into ova. And what are how? It usually immobilize or kill the sperm. Some have spermicide that kills, some breaks the, what are the motility factor of any spermatozoa? How it moves? Where is the mitochondria of any spermatozoa? It destroys the tail, okay, so it cannot move. And again, high failure rate, if it is used alone, it might cause again irritation and messiness, not ideal for sole contraception. These spermicides pictures are available in internet. Now coming to the intrauterine device, I think I will not discuss it today because it has been discussed earlier. Okay. Tell, how many types of intrauterine device is provided by Government of India? কি দুটো টাইপ? দুটোই তো দেখিয়েছে ক্লাসে, সেই দুটোর কি নাম ছিল? কপার টি, আর কি এগুলো নাম কি? 375 আর আরেকটা 380A, একটা 375 এ একটা 380A. What is 375 and what is 380? Surface area. And what is A? What is the unit of surface area? Surface area? এটা কি আর এসআই ইউনিট হবে? আংস্ট্রম মনে আছে? আংস্ট্রম। দিস ইজ দ্য সারফেস এরিয়া দিয়ে। আচ্ছা, নেক্সট হচ্ছে গিয়ে কখন হচ্ছে ইনসার্ট করা হয়? হোয়াট ইজ দ্য আইডিয়াল টাইম অফ ইনসার্টিং কপার টি ফলোইং ডেলিভারি? ফলোইং ডেলিভারি, ডেলিভারিতে মেনস্ট্রুয়েশন করতে হবে 48 আওয়ার্স এর মধ্যে, আর তারপর 6 weeks. What is the significance of 6 weeks? Yes, that's why after reaching the puerperium, copper T is inserted. Okay. Also, this is the generation. Look these pictures. I think this has been not shown, that these were the first generation IUDs. Okay, remember this lipase loop. This picture has been given previously in any, I think in JIPMAR. Okay. Now coming to the second generation IUD. These are, that was the earlier copper 7, copper T200, then copper T220, then come the copper T380A, nor Nova T, also the multi-load device. Multi-load device is now used, okay. And these are the third generation, which are hormonal. This is Progestat or LNG20, Mirena. We do not have those samples in our department probably, that's why it is, I put the pictures here. What Progestat given? 38 milligram progesterone. What is the action of progesterone if it is given solely? What it will inhibit? শুধু ইমপ্ল্যান্টেশন আর অনলি প্রজেস্টেরন দিচ্ছি আমি। ইস্ট্রোজেন কি করে? যদি শুধু এত প্রজেস্টেরন দেওয়া হলো যে ইস্ট্রোজেন কাজই করতে পারছে না, কি আটকে গেল? ওভুলেশন আটকে গেল, তাই না? And again LNG20 or Mirena, it releases 20 microgram per day of LNG and effectiveness up to 10 years. And it has also one side advantage, that it reduces the menstrual bleeding and anemia risk. That's why LNG20 or Mirena has been promoted very much. Okay. These are the lifespan. Try to remember copper T380 and the progestat and lipase loop. Okay. What are the advantages? It is simple, long acting, reversible and no systemic effects. What is the absolute contraindication? Pelvic inflammatory disease. Okay, and what are the relative? Anemia, menorrhagia, uterine anomaly and poor motivation. These were the pictures. These has been shown to you, and these were the copper 7 earlier, copper T 200, copper T 220. Actually these two pictures are confusing. Here 2 knots, you can see there are 2 knots in the 2 arm of this copper T. So this is 220, and in 380 there is no knots. Also here these strings are not continuous, some gaps in there. In copper T 380 there are no gaps. These two pictures try to remember. Okay, this is look like 7 and this is simple T. So simple T is always contains 200 only. Complication, again it can cause the PID. The first thing teachers want to hear PID, then uterine perforation. Okay, and also ectopic pregnancy it might occur. These 3 points teacher wants to hear. Bleeding and pain you will tell, and you will get only half marks in second. Expulsion and mortality is also some complication. Expulsion of copper T is very much common. Sometimes people complain that I cannot feel the thread now. What to do? If in your OPD, tiny OPD, you are sitting, one woman came, डॉक्टर साहब मैंने 4 हफ्ते पहले कॉपर टी लगवाया था, अभी मैं थ्रेड को फील नहीं कर पा रहा हूँ, क्या करोगे? एक्सरे করবো আর তারপর হচ্ছে কি ম্যানেজমেন্ট হবে? এক্সরে তো করলাম, ওকে, হোয়াট ইজ দ্য ম্যানেজমেন্ট হবে? কি ম্যানেজমেন্ট হবে? আমি কি আবার টেনে বার করে আনবো? টেনে বার করা উচিত, কেননা যদি বেশি ভেতরে চলে যায় it might cause irritation, it might harm the cervix. Okay, answer this. C. Why not IUCD 375? Why not? আমি বলিনি ভুল। Why not IUCD 375? Again ওটা একটা ফরেন নিয়ে হচ্ছে, কোনো কিছু যায় আসে না। ওকে, ইজি ওয়ান। কি অ্যান্সার? USG করব। কেন এক্সরে হলো না বলো? কেন এক্সরে হলো না? হ্যাঁ এক্সরে হতো, এমআরআই মেশিনেও কি আমি ঢোকাবো ওকে? এমআরআই মেশিনে ঢোকাবো না তো, তো রেডিও একটা হয় সেই জন্য। এক্সরেতে ইউজুয়ালি আসবেও না, ইউএসজি করেই দেখতে হবে। ওকে, হোয়াট ইজ ওয়ান? অ্যাসারশন রিজনিং টাইপ তো কোয়েশ্চেন নিশ্চয়ই দেখেছো। হ্যাঁ, দুটো কি আসে তো এগুলো নাকি? না আসবে না বলে দিয়েছে, আসবে তো। আর তাহলে দুটো স্টেটমেন্ট থাকবে, this is the usual option, both are true and reasoning is the exact explanation of assertion. R is the exact explanation of A. Both are true but R is not the correct explanation of A. A is true and R is false. A is false but R is true. Okay, the confusing is always option B and C. Okay, so now I will give only the assertion and reasoning. Remember the options. Okay, ফার্স্ট চলো কোন উত্তর এদিক থেকে? বি, আচ্ছা ঠিক আছে শুনলাম। সি, why? C means assertion is wrong. Assertion is wrong. Male condom has a higher typical use failure rate. You are what you are assuming, that is 2 to 14 and copper T is high, correct? But typical use is that what the typical use? Always focus on the each and every word. They also know that you remember the failure rates. Hundreds of you remember the failure rates. but they have to choose one. So they will trick the question. NEET PG is not a getting you past exam. It's how to kick you out from the race. Okay. So read each and every word carefully. It is the A, because you have to insert IUCD in a person correctly once. But if that couple using condom, the male partner has to wear it every time correctly. That is the game in the typical use word. Okay. That's why it is actually, I think you should keep 5 minutes for each assertion and reasoning if you can. In your NEET PG exam or INI CET exam, some questions are very easy. Each and every one you will answer it correctly. Okay. If you even nothing you read in the entire 5 years, still you will correct 40 questions. Okay. Then coming to the next 160 question. এখন কতগুলো 180 টা না 200 INI CET তে কটা কোশ্চেন 180 200 questions 200 na then 160 there is the game is there only. You have to read each and every word very carefully. You have to examine each pathology picture very carefully. Same goes for NEET PG. This NEET PG is also now ranking, I think, one of the 3rd or 4th toughest exam all over the India. And it's also a race. Not everyone will get into NEET PG. They will rank, but not will get seat. Okay, second. Then what B মানে হচ্ছে যে correct explanation নয়, then what is the exact explanation? এখন অবধি দুটো এসছে, দুটোতেই তোমরা গার্ড দিয়েছে, হবে না। আরো ঠিক করে দেখো, ভাবো বি আর সি এর মধ্যে আমি এটা বলে দিচ্ছি। কারণ 380 and 10 years it is all on the surface area. আমি দুটো আর্মে না দিয়ে অন্যভাবেও সারফেস এরিয়া বাড়িয়ে দিতে পারি। ঠিক আছে, আর্মটা একটু লম্বা করে দিলাম, তাহলেও হবে, আমি এখানে দিলাম না, একই ব্যাপার দাঁড়ালো। কনফিউশন তো পরীক্ষায় দুটো মার্ক করে আসবে। এটা ভুল, রিজনটা ভুল, এটা ভুল না রিজনটা ভুল? রিজনটা ভুল। আচ্ছা, এটা ভুল। আর কারো কিছু আছে? দুটোই ঠিক কেউ বলতে চাও, বা একটা ঠিক? না, একটা ঠিক তো এরাই বলছে। দুটোই ভুল কেউ বলতে চাও? দুটোই ভুল নয়? আচ্ছা, how nonoxynol 9 actually prevents the permeation or the how the fertilization? কি করে nonoxynol 9 prevents fertilization? What is the exact way? And epithelial disruption of the, not the pH. Okay, this is C. A correct, কিন্তু কি আমি তো explanation চাইছি যে what is the epithelial disruption. Okay, that is the correct answer. Nonoxynol 9 causes epithelial disruption of the vagina, not increasing the pH. Okay, and this is the best method of contraception said by someone.